Hi guys, this is Tori and Sarah, and today we're going to be measuring flexion and extension range of motion of the elbow. So to start, you're going to take your goniometer and align the fulcrum with the lateral epicondyle, and then the stationary arm is in line with the acromion process, and the flexible arm is in line with the styloid process. So you can bring your arm up into flexion. And so the normal range of motion for flexion is 140 to 150, and Sarah is at 143, so that's perfect. And then for extension, you're going to place a towel under the elbow, but not inhibiting the movement of the elbow, so we can see any hyperextension. So same thing. And then go ahead and extend. And she is at 7. And the normal range of motion for extension is 0 to 10, so 7 is awesome.
Hi guys, today we're going to be learning how to take a measurement of pronation and supination of the arm using the goniometer. And first, the patient has to have her elbow flexed at 90-degree angles close to her torso. And so the stationary arm is going to be parallel with the anterior line of the humerus, while the moving arm is going to be equal, distributed across the dorsal aspect of the radius and the ulna. So if we do that, your whole body's in front of my arm. Sorry, if you guys can see that. So if we do that, taking the measurement here, and Tori has about 55 degrees, which is within the normal range. And if I mentioned before, the normal range was between 0 to 80 degrees. So now we're going to be doing the supination. And once again, the stationary arm is going to be placed to the anterior midline of the humerus. Okay, so now we're going to be measuring the patients in supination form, and the palm's going to be facing up, and we're going to once again line the goniometer here parallel to the anterior midline of the humerus, and the moving arm is going to be over the anterior aspect of the radius and ulna. And if we take this measurement here, and she is at 53 degrees, which is within the normal range of 0 to 80 degrees. So now we're going to be doing the flexion and extension of the wrist, and the patient's shoulders should be abducted to 90 degrees angle, and the elbow should be flexed also at 90-degree angle, so she's doing a good job here. And the forearm should be resting on a flat surface to avoid any medial or ulnar deviation, to stabilize the ulna to avoid supination or pronation. So using the goniometer, we're going to measure the stationary arm has to be aligned with the lateral midline of the ulnar and olecranon. And we got it going on here. And the moving arm is aligned with the lateral midline of the fifth metacarpal, and the fulcrum is on the lateral aspect of the triquetrium. And so let's do flexion first. So she's going to flex, and I'm going to line it here. And our patient has about 78 degrees for flexion, which is within the normal range. And we're going to be doing extension, so once again, same thing. And she's going to extend. I'm going to line that. 5th metacarpal, and she has about 63 for extension, which is also within the normal range, which is great. So the mean for flexion is about 80 degrees, while the mean for extension of the wrist is 70 degrees.
So now we're going to be measuring the range of motion of radial and ulnar deviation. So you want to take your goniometer and align the fulcrum with the capitate. So you're going to follow the third metacarpal down till you feel an indent, and that's where you're going to line that up. And then the stationary arm is aligned with the midline of the forearm, and the movable arm is aligned with the third metacarpal. So then we're going to have her move her hand towards herself for radial deviation and line that up. And her measurement is at about 18, which is great because the range of motion for radial deviation is 0 to 20. And so now we're going to do the same thing and align it. And then we're going to have her move her hand away from herself for ulnar deviation and align with the third metacarpal. And for that, she is at about 28, which is also normal for ulnar deviation, which is 0 to 30.
So now we're going to be doing a manual muscle test, and we're going to be starting with the flexion gravity resisted of the elbow. And so I have to stabilize the shoulder and palpate the bicep brachii, okay, you can feel that, and apply increase resistance to the wrist in direction of the elbow flexion. So, elbow extension. And just going to pull down, and that's good. And she would score a grade 5, which means the patient can hold the position against maximum strength and resistance and can move through the complete range of motion.
So now we're going to be doing the test with gravity eliminated. So the patient is going to have their arm on a smooth surface with the shoulder abducted at 90 degrees and the arm fully extended. And this is going to be the supinated version, so her arm is going to be facing up with the hand upwards like this. And then we're going to have her move her elbow in and back out. So now we're going to be doing a manual muscle test of elbow flexion in a pronated position. So the patient's going to start with their arm pronated. You're going to palpate the brachialis, and then you're going to stabilize the shoulder, and you're going to bring the arm up into a slight flexion, and then you're going to push in increasing resistance towards extension while the patient resists. So ready? Awesome. And she would score a 5 on that as well.
Now we're going to be doing the elbow flexion with the gravity eliminated. And once again, the patient should be seated, and the shoulder should be abducted to a 90-degree angle, and the elbow should be fully extended. And I'm going to stabilize the shoulder, and I don't know if you can see here, but she is now going to complete the flexion. Great.
So now we're going to be doing the manual muscle test for elbow flexion. So you're going to bring the shoulder up to 90 degrees and then have them flex their elbow, and then you want to bring it back, and you're going to apply pressure in the flexion motion while they try to resist that. So go ahead. Awesome. She would score a 5 on that. So for the gravity eliminated version of elbow extension, the patient is going to be seated with their shoulder abducted at 90 degrees, and then their elbow is going to be flexed. And then you want to support the shoulder as they go through the movement and extend, and bring it back.
Now we're going to be doing the manual muscle test for the forearm supination, and the patient should have the elbow flexed at a 90-degree angle and the forearm completely pronated. So I'm going to stabilize the infralateral aspect of the humerus, and I'm going to palpate the bicep brachii right here, and now I'm going to be increasing the resistance of the palmar surface of the ulna and dorsal surface of the radius in the direction of pronation. So and she would be scoring a 5, which is great. Now we're going to be doing the gravity eliminated of the forearm and supination, and the shoulder and the elbow should be fully flexed while the patient is seated, and the forearm must be fully pronated. So she's going to be doing a motion like that. And we're going to stabilize the elbow, and I'm going to palpate the bicep. That's great.
So now we're going to do the manual muscle test for forearm pronation. So the patient is going to start in a seated position and have their elbow flexed at 90 degrees and start fully supinated. And then we're going to palpate the pronator teres. So now we're going to apply increasing pressure to the palmar surface of the radius and the dorsal surface of the ulna in the direction of supination, and you're going to resist it. So go ahead. Awesome, and that would be a 5. So for gravity eliminated, the patient's going to be seated with the shoulder and elbow at 90 degrees and start fully supinated, and then we're going to support the arm and palpate the pronator teres while they do pronation. Awesome. So one common injury of the elbow is medial epicondylitis, which is also known as golfer's elbow due to the movement that Sarah's doing. It's pain on the medial side of the elbow, which can be caused by inflammation or damage around the epicondyle of the elbow, and it usually affects the tendon in that area.
Thanks for watching!